Hi, I'm Kristen Walls, and you're listening to the Academy of Leadership and Innovations podcast, a place where leadership sparks possibility and innovation lights the path ahead. Each month, we speak with trailblazers shaping the story of physical therapy. Today's conversation features Mai Huong Ho Tran. Welcome.
Thank you. I'm so honored to be here, and especially with you of all people, Kristen.
Oh, well, I'm happy you agreed to join us before your world travels. So tell our listeners a little bit about yourself, who you are, where you're from, and kind of outline what we're getting into today.
Oh, goodness. It always seems a little bit like a daunting task to sum yourself up into a nutshell, doesn't it? But
Yes.
hi, everyone. My name is Mai Hung, and I am a loving partner. I am a mom of two middle schoolers, which I'm finding has been the hardest season of my life, right? If you know, you know. And I currently work part-time, 20 hours a week doing patient care. And the rest of the other time, I'm a mom, I'm a partner, I'm a daughter, all of those wonderful things. And it's been challenging to say, but within the last year and a half or so, I can officially call myself an entrepreneur. So that's been a really fun journey.
Wonderful. And we'll get more into what your entrepreneurship entails. But tell us a little bit about what brought you into pain science. What was it about pain science that caught your eye, caught your interest?
Well, I don't know that right out of school I would have been able to say, I'm going to dive into pain. But I've always been kind of an oddball kid. Maybe I think the phrase is marches to the beat of her own drums. And trust me, it was more than just drums. I was marching to something like an oboe or something. But I knew from the get-go, graduating PT school, shout out to Chapman, that I wanted to see pain in its most acute phase, right? I was one of those kids that loved watching gory movies, even though I wasn't allowed to. So I wanted to see pain up close and personal. So I decided to start off in the hospital setting in acute care. And I loved wound care. This might gross some of you out, but I loved getting in there, smelling the wound, seeing if I can, detect what stage it was in, like all of those crazy, nerdy things. And I definitely got an appreciation for pain. I got to see how people's personalities change when they're in
Mhm.
pain. I got to see lots of relationships within families shift and change, and not always for the better.
Mhm.
So that really made me curious about that because a lot of that was really heartbreaking. But I also saw the caliber of care that could exist when the staff, when the clinicians, when the providers were in a different space. And even though I couldn't quite put my finger on it or describe it as eloquently as I am now looking back, I just saw that there was something different. So I said, okay, I'm done with acute pain. I want to see the other end of it. So I don't know if you know this about me, but I'm kind of an extreme person. It's either one or the other. And then I find myself back to the middle. So I went
Okay.
the opposite extreme and went to a chronic pain program. It was a private program, private insurance, working with workers' compensation patients, and
Mhm.
I got to see the chronic side of pain. So that's really what drove my interest in looking deeper into how pain really affects the spectrum of someone's life path, as well as sort of how it changes in the rehab process.
Interesting. Thank you for sharing that. It's a lot of looking at the patient, but I'm curious as a leader in, this particular topic, how then does dealing with people in chronic pain affect you and your wellness and hearing nothing but, you know, um, I mean, people in pain, right? The
Yeah.
negativity that surrounds being in pain and kind of the discomfort and anger. How do you protect yourself? How do you inoculate yourself from absorbing that?
I don't know that it's something that we can necessarily truly prevent. I think again, hindsight is always 2020. And sometimes as we're going through that journey, it's difficult to see outside of the situation that we are currently in.
Mm-hmm.
So when I hear people that I admire, like yourself and other folks from the LAMP team, push me or label me into that role of, leader in provider wellness or whatnot, it always feels a little bit humbling, and I certainly feel a lot of bit of um, what's that word that I'm looking for when you feel like you are an imposter.
Imposter.
That's right. But when I look back at it, what I saw myself do, and if you had interviewed me a couple of years ago, I would have been horribly embarrassed to admit this. But I can admit it now because of the journey that I've been through with LAMP and with life and with leadership training. And, we can certainly get into that later. But I would have been horribly embarrassed to admit that I was really burned out. This person that arrives and takes care of everybody else and their mothers' pets, right? And there was a lot of shame and guilt in it. And the more I actually started looking into it and studying it, I've come to see that there is a ton of research out there on burnout already, right? We know that the three tenets of burnout is, it starts with emotional exhaustion, and then you get to this place where you don't really care. I mean, I hate to say it, but you don't really care about the patient or even your colleagues anymore. And I think um, I think it's a beautiful word that we use to label that second phase, and it's depersonalization. And
Mm-hmm.
it's really true. You don't want to um, really connect or personalize with that environment anymore. And the third part of that piece of burnout, I really felt, and I felt deeply, and that is feeling like I was not as impactful any longer, right? Even with my skill set of pain science and seeing things from a biopsychosocial lens, I would say that I am fairly confident in being a psychologically informed physical therapist, a trauma informed provider, and really being a holistic practitioner in terms of my approach, even before I knew the word for it, even before I understood what mindfulness was. I've always been sort of a look at the whole big picture kind of gal. And of those three components, the emotional exhaustion, the depersonalization, the one that affected me the most was feeling that I was greatly inadequate in being able to help and support these patients and families and even colleagues at that. Yeah.
Yeah, which is interesting because you are so highly trained and highly capable. I wonder, was there any moment that got pushed to the other side where you hit a tipping point? Was it COVID? Was it your allostatic load at home increased with your children? Or what, I mean, what got you there? What do you think was that point? Or was there one?
I think it's much more challenging to pinpoint a certain particular event
Hmm.
because our lives as humans is so rich and so beautiful, and there's
Yeah.
lots of complications and things that influence us. So I think it may be a little bit unfair to try to put pressure on a singular event.
Sure.
Um, but I would say that during the era of COVID, during the time of a lot of family shifts and changes, and ultimately changing dynamics of relationships of
Mhm.
people that I really felt and saw were, or I thought were really my ride or die.
Mhm.
and it didn't end up being that way. So I really felt, and I'm not sure if I'm supposed to share this, but I can only be honest with you. There
Mhm.
was a really long period where I felt um, the depths of loneliness and what it feels like to really be alone in a journey,
Mhm.
kind of handling everything on my own, going through lots of life changes myself. And I don't know where I heard it, but I heard the analogy of a bathtub. And if you don't know this about me, I love anything related to Paris, right? So the imagery of a bathtub with the clawed feet like really
Mhm.
gets me. So the analogy in the story of this person was you have a full bathtub, and as you live through life and as you continue taking your bath, the water is going to drain. And so the gut instinct for us is to plug that drain.
Mhm.
And we do a really good job of it, right?
Mhm.
We, get a massage, that's plugging the drain. We go for a coffee and a croissant, right? You see the Paris in me, right? We
Yes, I
do
love it.
these, we do these little things to plug the drain.
Yeah.
And then this teacher said, but what about refilling the bathtub with water?
Mhm.
And that image really stuck with me. And the thing was, they never said, how? How do you refill the bathtub? I'm like, just give me a list and a guideline and I'll do it, right? But the,
Right.
but the
Need a
teacher
protocol.
said, right, exactly, right? What's the guideline? What's the plan of care? But that person actually said, and now I hand it over to you. You have to figure out what filling of the bathtub means for you because it's going to be different for everyone.
Mhm.
So that sort of kick-started my journey into looking at, do I really want to be that person that shares more pain science knowledge with other folks? Do I want to teach the teacher? Do I want to instruct the instructor? And not from a point of vanity, because I've always been of the belief that when you teach, when you instruct, when you talk, you're the biggest student. And this is why I continue to do this because I'm so blown away by what I learned from every patient, every clinician I interact with. And so I really started with my role as director of a pain science fellowship. And that's coming to a close because it's the season in my life where that's also transitioning out too. And I went through the LAMP journey, and this was all sort of during the COVID years too, and helping me to sort of evolve and shed my skin to figure out at the core of me, who are you, Mai Hung? Like, what's your favorite color? There was a time period recently where I didn't even know what my favorite color was anymore. So just little things like that have sort of
Yeah.
shifted me into this journey. And the beautiful part about it is that it's not over. I'm journeying every single day, every moment, for sure.
Mhm. I just love how vulnerable you are because it's so relatable,
Mm.
sharing that deep personalization, that loneliness. I mean, I feel like so many people can connect with that. They often don't take the time to think about themselves and then what are their needs. So thank you for sharing that. I think you're going to find a lot of people also are there with you. And it's nice to know
I
you're not alone.
I thank you for giving me positive feedback, because what that's doing for me in real time is it's showing me that I can do it again, perhaps with another person. Because one of the things
Mhm.
that I'm noticing that's arising for me right now is how much distress I'm feeling because I didn't want to say, that I was there anyway. So I'm just noticing a lot of distress right now at the moment. So I thank you for holding space and being so kind. And that's a great lesson for me too. I hope that in my journey, as I continue working with providers and practitioners that I'm able to hold the same space that you're modeling for me right now.
Oh, absolutely. And we carry the armor so
Mm.
for so long, and it is so heavy. And when we put that armor down, it's uncomfortable. We're uncomfortable. So let's pivot just a bit and tell me how you're going to help people put their armor down. What is it that you have coming up that is so wonderful we want everyone to know about?
Oh my goodness gracious. If we're talking vulnerability, I'm going to share something which absolutely think needs to be normalized in conversation. Um, we never talk about miscarriages and the grief of that,
Yeah.
but I'm not actually able to have my own children.
Mhm.
So this thing that's coming up is my baby.
Yeah, yeah.
I feel like I have birthed this baby, girl. Um,
Mm,
it kind of started, and I didn't know it at the time, but when I had the opportunity to adopt my oldest back in 2017 rather. Oh gosh, I can't believe I forgot that. This is like perimenopausal brain. I'm so sorry.
yes, understood.
Which is another topic we should normalize, right?
Yes.
But back when I first adopted her, I had the opportunity to, for the first time ever, go away, excuse me, to go away on a retreat. And in that retreat, it was a movement-based retreat. And the thing that I walked away from that weekend was how pivotal and important it is to not just have cognitive knowledge of something, but experiential knowledge of something. And very soon after that retreat, I came across a book called Chop Wood, Carry Water. I try and share that book with anybody I know, but there's one chapter in there that asks the question, hey, listen, if you were to go into battle, do you want to go behind a captain who has 25 years of book knowledge, war tactics? Or do you want to go behind someone who has 25 years of being on the battlefield? And that's the importance of experiential knowledge. So that
Mhm.
started this idea in my mind of I, hands down, not vain, I'm good at teaching movement. I can get patients to do things that they would have never thought they could have done. But when I really look at it, it's not in one session, but it is learning about who they are, taking and considering the whole big picture of who that
Mhm.
person is. Do they fear movement? What do they associate movement with? Is there any essence of joy when they think of movement? Or do they think of, yikes, I don't want to move? And so it's twofold. It's the ability to be able to hold space for who this whole person is, but it's also being able to arrive as your best, most authentic, vulnerable, transparent self. And it's the combination of the two. So, my goal, and this is what I've been working on in the last year and a half, is to actually create a continuing education course that isn't just book knowledge or didactic or, meet in the basement of a hospital conference room and talk about it and have a lab here or there, which is all great, right? I attend those courses. Please
Mhm.
know that I'm not saying anything negative about it. But beyond that, I want my Con Ed course to really instill and to give folks this actual space to practice these different things and to have experiential knowledge. Because when you experience what you are learning, that's when the brain really locks it in.
Mhm.
So the Con Ed course has all of this content of all of those things that I was just sharing with you a moment earlier, the
Mhm.
integration of breath work and the science behind it, movement, but the experiential execution of movement in a graded and paced way, not only for yourself, but how to teach it and the skill set to teach it. We're going
Mhm.
to talk about readiness for change and motivational interviewing, not just in theory, but to do the actual practical application of it.
Hmm.
And the fourth component, which I love the most secretly, but don't tell the other three components that, right, is what I have lovingly termed authentic appraisal. So
Hmm.
that has two faces. I want to share with folks how to really look at every client, every person through the lens of a holistic practitioner. And that includes pain science, looking at all of those different components, looking at it from a trauma-informed, psychological informed lens. We're going to include all of that. And the other side of the coin is that same authentic appraisal of self, really looking at who you are, practical skills and strategies that the therapy world has been holding on to, right? We're going to bust open the seams and really give practitioners this opportunity, as well as equip them with the skill sets of how do I figure out what my triggers and my patterns are? How do I better communicate with this particular personality versus this particular personality? And how do I know to shift and evolve and change myself in such a way that I can continue to arrive as my best self for that patient interaction and then for that next patient interaction when I only have 5 minutes in between, right?
Hmm.
So we're going to do this Con Ed course and we're actually going to go away to a retreat center. So it's a 2.5 day Con Ed course at a retreat center. I'm super excited.
Oh my gosh. Yes. And it's looking at your website, the beautiful photos of where, I mean, it looks so tranquil and to be learning, patient care, but also self-care kind of things and weaving in the pain science piece and just how beautifully you speak and like the gentleness and the invitingness of asking someone to look deeper, right? Really kind of peeling back the layers and getting to that authentic self. I think, I mean, that will change how people communicate with one another, how they practice, how they interact with their family and community. You're healing the whole person.
I sure hope so.
Yeah.
In my journey, one of the things that I came to see, oh gosh, my goodness, when I look at it, it overwhelms, but it also humbles me because I've been practicing for almost 25 years now, and I still feel like a rookie. Every day, every patient interaction, I'm like, WTF am I doing with this person? I don't feel equipped to help this person at all. But it really is the patient that I've learned the most from, right?
Mhm.
That word that I tend to use a lot, invitation, inviting
Mhm.
someone. I
Mhm.
actually got that from a patient. When I asked them to do something, their response to me was, my home, if you're going to ask, I'm not going to do it. But if it feels like an invitation to a gala or a party, I'll reconsider. And that moment stuck with me. So
Yeah.
as I'm teaching, as I'm walking someone through a meditation, I will often not or refrain from saying, and now, etc. But I'll say, I'd like to invite you next to et cetera, et cetera. I think it shifts something in the mindset of the brain to be told to do something versus being invited to do something. So that's just a small example of how impactful patients have been for me. But again, that only would have happened if I arrived in a good state myself, that I was clear and calm in that moment, arriving as my best self so that I could pick up on all of those things. So, making sure that we address both sides of it, the skill set for the patient interaction, but also the skill set of myself as a practitioner. That's what I want to do with these Con Ed retreats.
Oh my gosh. It sounds like it's going to be fabulous. So, how did the light bulb go off for you to say, oh, this is my life's work. This is what all of this experience and knowledge has been pointing me toward. What was the moment?
Again, I'm gonna I'm going to push back on you a little bit, only because I know that I can.
Yes.
Have that singular moment, I don't think existed for me, but
Okay.
there were a lot of little moments that kind of all culminated together. I've myself have done lots of, religious as well as secular retreats, and I've
Hmm.
always noticed great benefit from it. Um, but last year, and I'm frugal as heck, girl. I mean, you try and get me to spend $1 on you, that ain't happening, right? I'm generous, but I'm frugal. But last year, my partner actually convinced me to actually get a business coach.
Okay.
Because I realized, I mean, I don't know what the heck I'm doing, right? I just know that I have this idea. How do I make it come to fruition? So I
Right.
splurged, I got a business coach, and she asked me one day, she said, what does a holistic health PT look like? And she was asking not as a business coach, but genuinely. She's like, I don't know what that is.
Yeah.
And I went away from that session. I thought, wow, what does a holistic health PT actually look like?
Right.
And she gave me some homework. She said, start with the material, start with the look. How does
Okay.
that person dress? What kind of pants, shirts do they wear? Do they
Okay.
wear jewelry? How do they, style their hair? Do they wear tennis shoes or flip-flops or Birkenstocks? I mean, she said, just start with the outside. And that literal transformation also really helped me to start to transform the inside as well. Like, as a holistic health PT, do I practice what I preach? Do I fill the bathtub up with fresh water, or do I just keep plugging the drain, right?
Yeah.
Can I be transparent and vulnerable with other people? Can I sit with distress and model that for my kids, right? Or do I
Mhm.
hurry up and try and get over the distress and try and come back to a happy space? So all of those things, I think has continued to help me. But if you were to pin me down and I had to think of a moment, I think that question from Stephanie, my business coach, was really, it started an avalanche of
Oh,
thinking.
wow. Oh, that's so cool. So I'm curious, when you described this individual, was it currently how you were dressed, or have you kind of morphed your external to match what you envisioned this to be?
Oh my goodness gracious, this is so funny that I'm laughing on the inside because I don't know if I want to share this with you because
You can pass if you want to. That's okay.
and
That's real. I think that's
this
real life.
it is. It absolutely is real life because if you saw me even just a year and a half ago, okay, I want you to imagine the traditional PT uniform, right?
Got
I've
it.
got my collared polo shirt for my organization, right, with the logo on that
Yeah.
says 15 years of service or something like that, 20 years of whatever years of service, right?
Yeah.
And I've got fitted pants on,
Khaki?
and cut, yeah, yeah, and kind of cut off at the ankle,
Okay.
as well as ballet flats, right? Sort of like,
Okay.
the cute PT, and that's great. And I rocked it. I thought I looked
Hmm.
cute,
You
right?
probably
But
were.
and if anybody who's listening is dressed like this right now, I promise, please know that I'm not, making fun. I rocked that for, two-thirds of my career up until a year and a half ago.
Yeah.
And it was great. And then the more that I thought about this, I I said to myself, yeah, those tight pants are really tight. I mean, I
Mhm.
just want to wear loose clothing. So now I'm often in just like loose linen pants. They're big and wide leg. They still look professional, but they allow me to move and squat and get on the floor because as someone who's really into, practical functional application, I am always climbing all over the place, up and down on the floor with patients. somebody a couple of weeks ago was trying to, work with her cast iron skillet. I brought mine in. We were working on squatting. So my look now is, my hair is often down and flowing. It used to be up in a bun all the
Hmm.
time. I mean,
Same.
all the time, right?
Hmm.
And so now I'm just in big, comfortable linen shirts or sweaters and big wide leg pants.
I love that. Okay, so now let's take the leap. You've changed the clothing, maybe the restriction that maybe how has it changed how you practice or has it?
Mm. I'm going to use that example of the cast iron skillet patient,
Okay.
um, because when I'm comfortable, now I'm comfortable, right?
Hmm.
Physically, but
Yeah.
also emotionally too, right? I can better hold space for people.
Hmm.
And that particular day, she came in and she actually said, I love and adore you so much, Mai Hung, that I do everything you ask me to do to a T. And I have been struggling with whether or not I should give you feedback. And in that moment, I took a deep breath and I said, so and so, I'm in a really good space. I am here to better myself, but to also make sure that our relationship works and benefits you. You
Hmm.
are the most important piece in this therapeutic relationship. I want to know your feedback. I'm curious about it, and I want to know what I can learn from it. That's
Hmm.
almost word for word what I said to her. And I give her such credit. She was so brave, so courageous. Because, right, you think about when we try to give feedback to somebody, how much anxiety that gives us. Like, should I say
Hmm.
it or not? And she took a deep breath and she said, "You progressed me too fast. And I am in such a big flare up. And I don't need to do all those things." And I asked her, "Well, what is it that you need? What is it that
Hmm.
you actually need that I missed?" Right? I apologize for not being present, for missing that. What is it that you need? And she said, "I just need to be able to handle my 14-inch cast iron skillet." So I says, okay. That's what I said. All right. We did something else that day. We did a little bit of like body work, contract, relax. We did a little bit of goal setting because in pain science, goal setting is a part of treatment and talking to her
Hmm.
about graded exposure. So I did that lesson with her. Then when she came back 2 weeks later, right, I surprised her with my 14-inch cast iron skillet. And so
Uh-huh.
that session allowed us a lot of laughing, a lot of joking, and what was really important to her, which was being able to functionally handle her kitchen duties, because that was the most important thing to her.
Hmm.
So that piece of it, I continue to journal about that story, and I, was recently giving a big online conference to some social workers in Vietnam, and that's the story that I shared with them. What it
Yeah.
means, it doesn't matter if you're a social worker or I'm a physical therapist. Are you well enough to be able to arrive in that moment so that you can hold space and really listen to that client sitting in front of you?
Yeah.
Yeah.
I mean, something as simple as clothing can, I think, make you more approachable, remove
Mm,
that perfectionism you probably expect from yourself,
mm.
make you comfortable and present, and that's so wonderful. We need a new professional wardrobe.
Oh.
Long gone are those polos and tight khakis. Let's be comfortable, let's be professional.
Yeah.
Oh my goodness, I love that. So
Mm,
in these moments, I know you are a big outdoorsy person. I know you
mhm.
love yoga. How do you care for yourself? How do you make sure your
Ah.
cup is full, your tub is full, so you can arrive for others?
Well, I have to transparently admit that I don't always do a good job of it. I learned a long time ago that, we naturally gravitate towards that which we need most. So maybe this is why the universe has moved me to, coming of age genre books, has moved me to the work of mindfulness, has
Mm,
moved me to um, dive deep into movement practices like Tai Chi and Qigong and yoga,
mhm.
because I need those things more than the clients and the students and the colleagues that I work with. So those things continue to provide me with an avenue.
Mhm.
But trust me, it's not easy. I struggle. I struggle every morning to get my booty up out of bed and say, okay, you're gonna do the chia seed and yogurt for your digestion. You're gonna do the things that will help with perimenopause. You're gonna do those things for yourself. And I'm always happy that I do it afterwards. But
Yeah.
trust me, the initial and the during, sometimes I'm like, oh my goodness gracious, what am I doing?
Oh my
So
goodness.
one of the things that I have really come to see is motivation follows action. If we all sat around and waited until we were ready to do something or motivated to do something, I don't
Mhm.
think, half the inventions that we have in our modern world would actually happen, right? But you just got to do
Yeah.
it. And it turns out that that's the way the brain works, right? That action leads, action first, do it. And then the brain will be like, oh, okay, so this is the new normal. Okay, I'll go ahead and adapt to this. So oftentimes, that's how I fill myself up.
Yeah.
I make sure that there's always, some kind of movement. I was just doing some strength training with both my girls this morning now that they're out of school. Um, I make sure that there's time for journaling every night. And that for me isn't for any other altruistic, gratitude journal reason, for the simple task of being able to have a space to process, right? Like what happened in my day. And as I go through that with a lens of curiosity, I ask myself, what did the universe want me to learn today? What did God want me to take away from today's life?
Mhm.
And there's always something, whether it's big or small. I think the alchemy of the universe always comes together with at least one or two things that maybe it's not apparent, but at least the seeds of that lesson keep showing up.
Mhm.
Most recently, the lesson for me has been uh, communication is one thing, but ensuring understanding is a whole other thing, right? So making sure that um, those things are there for me. Another way that I fill myself up, and this may sound like a facetious joke, but it isn't. Having a coffee and a croissant is my idea of luxury. Growing up with immigrant parents who came here literally by boat and, living off of food stamps for a long time when we were little, that it just makes me a little bit emotional to think about what my parents have gone through for me.
Sure.
Going through all of that, I never, remember I'm frugal, I never
Mhm.
allowed myself coffee and croissants. Those were saved for special occasions. When you have a special occasion, you go out to a big fancy dinner. When I think of a treat for a special occasion, I just finished the LAMP Leadership Board Certification. My reward to myself is a coffee and a croissant because in my mind that's associated with luxury. And so
Yeah.
as I've evolved into this person who is a little bit more authentic, do you know what I've done, Kristen?
Tell me.
I let myself get coffee and a croissant way more often.
You should. There's
So
something to
embarrassed to say
celebrate
that.
every day, my hug. Yes, as you should. Celebrate all your successes and, everything you've done, all the people you've helped, even, I mean, gosh, you're worth it.
Mm, that's very sweet of you.
Poor
I
thing.
absolutely do agree with you that celebration is a good thing because it's not just celebrating your own efforts, but everybody else who has walked the trenches for you, right? I mean, you and I, we stand on the shoulders of giants that have already carved this path for us.
Mm-hmm. It's pretty incredible when you think about
Absolutely,
it.
yeah. I think
Yeah.
of like all of the people who have done this work of, mental health and burnout, like, Joe Tada and Lisa Flexner and all of the people before us, right? Who've
Mm-hmm.
really done this work already. All of the pain science people, Adrian Lowe and all of his work.
Mm-hmm.
Yeah,
Mm-hmm.
I love
Yeah.
it. Yeah.
When worlds
And
collide, here you are, right in the
absolutely,
middle, the
absolutely.
bridging it. You're bridging it
Yeah.
together, which is,
Oh, I really like that imagery. I love
yeah,
that.
you're the
Yeah.
bridge. And I
Yeah.
mean, run with it, right? You've got a unique knowledge set that
Yeah.
we need. This is a gap. Yeah.
Can I share something with you, Kristen?
Tell me
When
more.
when we talk about like pivotal moments,
Hmm.
when two of them happened within the LAMP leadership journey. The first was the very first class of our beta cohort.
Okay.
And one of the gals in there, Miss Cindy, oh my God, she's amazing. I just love her to pieces. She said, authenticity needs to be exercised like a muscle.
Hmm.
And without knowing who I was, she was able to present a piece of information in a way that landed with me well. So the lesson that I took from that was twofold. Not only that, how do I continue to become authentic? I just have to keep practicing it every moment I get. But the bigger lesson that she taught me in that moment was her skill and ability in being able to present information in a way that the receiver would be able to receive it. That was brilliant.
Ooh. Now,
Yeah.
what do you think she did that worked for you? Was it non-judgmental, like a non-violent communication style? Was it that inviting you to consider yourself in that situation? Can you
It's
think of
funny that
how it
you say
was?
that. It's
Yeah.
funny that you say that because this self-deprecating imposter Mai Hung shows up to this class like, why are these people asking me to be a part of a leadership certification? I don't know what the heck I'm doing. Right? I ain't no leader. And I was, sort of presenting that. And what she said before she shared all of this was, could I give you some feedback? She asked my permission. And I'm like,
Mhm.
oh, I mean, was just expecting her to say something, but she caveated that by creating a space holder where I felt this locus of control. I could say yes or no. And she actually
Okay.
said that. She said, could I give you some feedback? And you can say yes or no. Brilliant, right?
Yeah.
Totally brilliant.
Using a
The,
coaching model on that.
totally,
Tough
totally.
subject or whatever she wanted to have.
Absolutely. Yeah.
Yeah. Do
And
you then use that in your practice? Or with your family or anyone else
yes,
you interact with?
for sure, for sure. Since I
Mhm.
learned that skill set, I've been much more intentional about asking a patient, I have some information. Do I have your permission to share it with you? Or, which body part would you like to address today? Or, just being able to put that locus of control on them and shifting that sense of responsibility in them. Because I think as an individual, and especially as someone who lives with persistent pain, we often don't feel like we have much control.
Very
Yeah.
true.
Yeah. But
Yeah.
the second moment actually involves you, Miss
Oh
Kristen
no.
Walls.
Oh boy. What did I say this time?
And oh, you have always been so brilliant. And this was when um, I think another one of our colleagues, Runda, she asked if we would do a talk together for Duke.
Hmm.
And the first thought in my mind was, I'm this movement pain science gal. I'm not a a wellness gal. I'm not and I mean, it's just one thing that I would love to share with people about, but that's not my thing. That's not my realm. And you said people come to things in different ways, and this is just an in. Could it be an in? And what I took from that was that we have all of these different facets of us. And if we open ourselves up to whatever arrives to us from the universe,
Mhm.
it will naturally evolve us into and call us towards whatever calling that is supposed to be for us. So I thank you for that.
Oh, you're welcome. I've always wanted to collaborate with you and learn more. I feel like I learned so much from you and so much peace and grace and patience from you. I always walk away with a little tidbit from you. So thank
Mm.
you.
Oh, that's
I
so
enjoy.
nice for you to say. I'm only able to have, grace and peace and all of that is because I mess up about 1,274 times every day. Like every day I'm like, what am I doing as a parent? I'm totally messing this up. I'm gonna mess my kids up.
No, I am sure that is normal, right? Let's normalize that. Every parent feels that way,
Oh
right?
my goodness.
Yes. Oh my goodness. No, I'm sure you're doing fabulous and even better than that, to be honest with you. So it sounds like you've provided a little bit of these inner anchors that you have for yourself. And one
Mm,
that we really haven't touched on that you speak about is spirituality. So we know that a lot of spirituality does actually help fight against burnout, right?
mhm,
And it's not necessarily religion as much as it is knowing your values or knowing what your mission statement is or knowing why you're doing what you're doing and there's something bigger. So tell us a little bit about how, I guess, you operate in that space and how does that help you stay grounded and stay focused and work through the tough stuff?
Kristen, you could not have asked about a more important topic that resonates with me.
Yeah.
And yes, I'm a religious person, but I hope that we can set religion aside for a moment, right? Whatever that religious practice is, let's just set that aside for a moment and just talk about the the existence and the quality of the presence of spirituality in an individual's life. Um,
Mhm.
I think having um, these tenets that continue to guide you is my version of what being a spiritual person is. And we all have core values, right? I heard this talk a couple months back with I think it was Simon Sinek, Brene Brown, and Adam Grant, and they were talking about really whittling down your core values. And at the very, very core of who you are, most of us really have only just one or two basic core values. And when you live outside of that and it doesn't align with who you really are, that's when we feel this sort of distress. So for me, the journey of figuring that out, Mai Hong, what are your core values?
Mhm.
That took a long time. And it took actually a lot of trial and error to really figure out what that was.
Mhm.
And I've come to know that at the core of who I am, I want a sense of belonging or community.
Mhm.
And my second core value through and through is autonomy. And I decided after I figured out that those were my two core values, that everything that I do from this moment until, I'm 6 feet under, everything that I do needs to align with those two things. So whether it's creating a sense of community and belonging for others, because in doing that, that helps me feel belonging and in community with others. whatever
Mhm.
it is that I do, I want to have some sort of agency or autonomy. So that means empowering others to also have autonomy and agency over their care, over their burnout prevention, over their knowledge base.
Mhm.
Whether it's my two daughters or my partner, right? Everything that I do, look, think, say, feel, I want to, my goal is to have it align as much as possible with those two core values.
Mhm.
And that to me is maintaining spirituality.
Yeah. And you've kind of talked about, what's for you will not pass you by, and you will keep repeating the same lesson until you learn it. So, I mean, you've talked about that in a different, more elegant way, but I mean, it's true. And I myself have also felt like you're just banging your head against the wall. You're not learning your lesson, or why did that person cut me off today? Maybe I need to slow down. You know what I mean? So
Yeah,
I love how you framed this out, and it's not always about religion, but it's the spiritual piece of putting all the pieces together and what is at your essence, like what is your core.
right.
Um, what a great,
Yeah.
great way to find yourself and your alignment. That's the word, right?
Oh, trust me, it wasn't easy.
It takes a long
And
time, right?
and I'm still discovering who I am because
Mhm.
I mean, isn't that such great news that we can continue to discover who we are, right?
Yeah.
And it keeps evolving and changing. And I love that you said that earlier because I think it's so true. Whatever lesson the universe or whoever it is trying to teach you is going to keep showing up until you learn it.
Yes. And
I
some of
can't
us
tell
are
you
real
the
stubborn.
Yeah. Oh, trust me. If we were to have a competition, I would win this one, Kristen. I am so stubborn. It does not get more stubborn than a Vietnamese female, right? Trying to raise two middle school girls. I'm
Ooh.
stubborn.
So, well, let's not mess with my just let her do what she's going to do. Okay. So we know CSM's coming up, and we know it's in Philadelphia this year, right?
Yes.
Who is out there that you would be interested in meeting? Do you remember who we spoke about a while ago?
Oh
A
my
famous
goodness.
athlete, a
There are
pair of athletes.
there are so many, and I'm
Who
I'm
has that Vietnamese spirit that you're like,
I'm too embarrassed to say. You have to say it for me. I'm too embarrassed.
Jason Kelsey, Travis Kelsey?
Oh my God. Oh
We are hopeful when
my God.
we
I'm
go to
so embarrassed.
CSM that the
Don't
Kelsey
even say
brothers
it.
will show up at CSM. I'm from Ohio, and they're from Cleveland Heights. We're
Listen,
going to
listen.
Philly.
Oh my gosh, don't even, because my perimenopausal Kegel exercises are not working right now. I'm gonna pee my pants. Oh my God, because you know why?
We're
Listen,
put in the universe. Come on, my
no,
hon.
I'm a professional. I'm
Hmm.
supposed to keep it together.
Yeah.
But anytime I hear about Jason Kelsey, Travis Kelsey, I mean, I'm not even like into the whole big like fandom, but every time I hear about them, I get so like fangirly. I'm so embarrassed.
But tell us why. What is it about them that is just like so appealing to you?
Oh, I'll tell you right now, hands down, it's the interaction that they have with others.
Okay.
That ability to hold space for relationships, that just wows me.
Yeah. And they don't take
Yeah.
themselves too seriously.
Yeah.
They are
Yeah.
authentically themselves, and
Yeah,
they've
they're
earned
like
that.
the most self-deprecating pair of brothers. And I mean, I could totally see like who they are is what you get. And I could totally see them as youngsters and brothers. There's a story about like one of them like driving a car through a garage or something like that. And
Seems right. Seems right.
oh my
Oh,
God, Kristen, I'm so embarrassed because I'm such a fangirl.
oh, we're putting it out in the universe. If Kylie hears about this, she's from
Oh my
Philly. She's
God.
a Philly girl.
Oh
We're
my God.
coming in February.
I actually I commute quite a long distance every Thursday night. So that she accompanies me, her podcast accompanies me
Yeah.
every Thursday night.
I love it. See? Kismet,
Oh,
it's
thank
supposed to
you, honey.
happen. It's going to happen. We'll make it happen.
Oh my God, I'm so
Oh
embarrassed.
my goodness. We'll see. Look, we're just regular people out here.
Mhm.
We have our own things that we love. Well, that's wonderful. Okay, Maya, we're getting back on track here.
Okay,
Um,
okay, focus.
okay, so we're kind of winding down on time. What would be, I guess, what is the best advice you've ever received? And then we'll do what is the best advice you've ever given.
Oh, wow.
And it can be life or work related. There's no limits.
Mm, mm. Um, when I was in college, I went to an all-girls school. I went to Mount St. Mary's. It was college back then, but they've changed their name to Mount St. Mary's University now. There was an older gentleman who was a volunteer for our front desk.
Okay.
And he was in his 80s. I mean, he was quite up there in age. And every time you went by and interacted with him, he would always have some adage to say. And it was different for every person. And so one of the things that we did as students was to just go visit Mr. So-and-so, so that we could hear what new thing he would have for us that day. And one day it started to sprinkle, and his adage for me that day was, "Don't melt in the rain now, 'cause I think you're that sweet." He said,
Oh.
"Don't melt in the rain now, 'cause I think you're that sweet." And for him, it probably wasn't anything big, right, or important. But again, that ability to connect and have relationships
Mhm.
has always stuck with me, right? How you relate to other people. But I think the most important relationship is the one that you have with yourself. So I think maybe that might be the thing that I would leave with others. And I literally just came up with that right now, as I thought about that older gentleman. I think what he taught me about relationships is what I take with me, and what I would share with others is the relationship that you have with yourself is the most important one.
That's beautiful. And it's so true. And we need to practice that more often.
Mm,
Yeah.
yeah.
Well, we're at the top of the hour here. So, Mai Hung, thank
That
you
went by
so
so
much.
fast, Kristen. And
I
thank you for
know.
making this such a safe space. I I will wholeheartedly admit that that was nerve-wracking going in, but you made that so fun. So I thank you.
Oh, thank you for just coming and being your authentic self and sharing everything and even your girl crush, your girl fangirl crush on the Kelsey brothers. They're coming to see us and we'll make it happen. But I do want to remind people if you would like to check out Mai Hung's Holistic Health PT, that's her company, and her retreat will be on August 7th through 9th of 2026. It is a Friday through Sunday and it is in Mount Madonna Center in Watsonville, California. Is that correct?
Yes. Yes.
Yes.
Yeah.
So you can register for that on her website if you'd like, or just check out what she's up to. I think you have some free meditations maybe for people to look at.
Absolutely.
Yeah.
Absolutely.
So you could start your wellness journey on her website if you'd like.
Thank you
So
so much, Kristen.
yes, thank you
Thank
for
you,
coming.
everyone.
All right. Thank you for joining us on APTA Academy of Leadership and Innovation podcast, where leadership advances strategy and innovation drives our profession forward. We hope today's discussion equips you to move with clarity, influence, and purpose. Until next time, continue shaping the future of physical therapy with intent and impact. Thank you.